So we want to be healthy to reach 90 years old, and longevity, healthy long life would be our goal. So people ask me what kind of a blood work or test it can predict their health condition, and the next 20 years they won't develop a dementia or Alzheimer's or heart disease.
Yeah, that's such a difficult question,
Yes.
because there are a lot of tests that are associated with diseases, but
Yes.
maybe not necessarily causative of the disease.
Yes, that's the good point. Yes.
But people who have some type of inflammation, typically we test the ESR, the erythrocyte sedimentation rate, or the CRP, the C-reactive protein, and those are two most common tested markers of inflammation in the blood. And either of those could indicate some autoimmune disease going on or an infection in the case of CRP typically. But sometimes those can be negative and someone can still, or zero, and someone can still have some type of autoimmune process going on or some infection going on. And we'll have to figure it out based on their symptoms. Really.
Yes, and in Chinese medicine, the symptoms, the tongue and the pulse, we put together. And if sometimes it's just functional problem, it's not a organic problem. So if you test the blood or other genetic tests, then it won't show up. And on the other hand, if you do a whole panel of the test and costs over $1,000, I really don't think it's necessary. Do you think?
I don't think so, because you have to ask yourself, if you're doing this test, what are you going to do with the information that comes from it? What's the result, right?
Yes.
So if the test shows that you're positive, or you have all these different things, but then you don't have all these different things, how is it going to change your lifestyle? Is it going to make you be extra cautious about your diet to where you prevent yourself from any enjoyment in life and don't eat any sweets ever again?
Yes,
right?
yes,
but then,
exactly.
But then maybe you live, an extra year or 2 years. I don't know exactly. I'm making up numbers, right?
Yes,
but
yes.
Then you don't have any quality of life or any enjoyment. Whereas you could have lived 2 years fewer,
yes,
and enjoyed your life the whole time, right? So
exactly. So especially genetic test. I don't want to get that genetic test making me, because the genes only play 10-15%, and even my family member has a lot of people have cancer, but first of all, those cancer are not inherited. Second of all, even though it's inherited, I can still play my part, right? I have over 85% chances that I control, those bad genes not be turning on. So I think that, going through all the genetic tests and tell you that, oh, you're prone to this, you're prone to that, and that'll create anxiety, right?
It creates anxiety, but it's also, you have to think for the person, right? So the BRCA genes, I think, can be worth testing for some people, right?
Yeah.
So if you have a much higher chance of getting breast cancer or ovarian cancer, are you willing to do surgery, right? Are you willing to have a mastectomy, have your ovaries taken out, right? And
yes,
and if you're willing to do that to totally eliminate your risk of getting cancer because you're at slightly elevated risk, then maybe it is worth doing the test for that person, right? Yeah. So it just depends on the individual. It's a little bit extreme, but some people have done that because they just don't want to even worry about having
but even that, see, like for instance, I have some female patients, and they had a hysterectomy just because they want to prevent ovarian cancer and uterus cancer, and then they still get other cancers.
Right.
So it's not really you should take out the organs and then prevent something. I think we just need to manage the diet and nutrition. Diet.
Yes. Exactly. I think soybeans can be very helpful.
Yes.
There's some research that shows that soybeans can actually decrease risk for certain cancers like breast cancer. So that's interesting.
Yeah. Especially fermented soy, because they serve as a very weak phytoestrogen, and it occupied the receptor for the stronger estradiol, which stimulate the uterus and ovaries. cell to overgrowing. So, and actually there are Canadian study, European study, they compare the breast cancer patients. One group does not take any tofu, the other takes some tofu for a few months, and the tofu group or phytoestrogen group actually survive longer.
Yes, that's true. I have read that
Yeah,
study.
you read
Yes.
that study too.
Yes, and
Yeah.
it's interesting because there's also natto, right? Is fermented soybeans. You can
Yes.
get natto, right? It's a
Yeah.
traditional food. You can actually get it online.
Oh, natto, yeah.
And most people don't like the taste of it,
The
but
smell
I actually like it.
is the taste.
But it can help potentially reduce risk of dementia too.
Oh,
Yeah,
that's
there's
even
some
better.
new research on that, and I think it improves blood flow as well.
Oh,
so I think there's a lot of
okay.
benefits to having these fermented,
But they
products.
think about the prostate cancer, and most people saying you have to block the testosterone, which I think it's wrong, because prostate cancer usually happens to older men, and by that time their testosterone is going down. It's increasing estrogen, especially the drinker, the alcoholics. They have higher estrogen level because of the belly fat, because the dysfunctioning in the liver. So if they can take some phytoestrogen, tofu, and natto, is that the thing?
Natto, yeah, it'd be interesting to see research in the future.
Yes, they actually did that research, and that blocked the estradiol, the bad estrogen. So that reduced the risk of prostate cancer. So I think diet is every day you take that, so it serves as a medicine, right?
Yes, and I think berries are some of the best sources of antioxidants that people can get. And if you look at what's available in the supermarkets, it's very limited. It's blueberries, raspberries, blackberries, strawberries, right? But there are other berries out there like honeysuckle berries, honeyberries, which I think are much more potent antioxidants than blueberries. There's sea buckthorn berries, there's cranberries that people almost never eat, right?
They're too sour. Yes.
I actually like the tartness of
Oh, really? You like it?
Yeah, it depends how fresh it is, I think. It changes the tartness.
Taste.
I think if you get them when they're not totally ripened, then I think it's a lot more tart than if you get them when they're very fresh.
Yes.
Interesting.
So in Chinese medicine, the sour taste and the bitter taste are the good taste. Like, but I don't think too much spicy food are good. But sour, like vinegar, like the cranberry or lemon, they are actually anti-inflammatory. So those sour tastes you have to make you like that.
Yeah, I think a lot of people, in Western society have issues with kidney stones and gallstones too.
Do you think the sour things can prevent those?
Citric acid can help prevent kidney stone development.
You mean like
so from
orange?
Lemons, oranges, because it prevents the calcium from binding together and forming the stone with calcium oxalate, and instead binds the citrate and forms calcium citrate.
Oh.
So that's one of the first types of treatments to try to prevent
the kidney
stones.
Yes.
There's not any literature on this, but I also think that traditionally, so in Morocco, they used parsley for this, going back many generations. So I think that there is some evidence in animal studies actually that parsley can also help with this, with preventing or breaking up stones like kidney stones specifically.
And parsley in Chinese medicine is the herbs that we use to treat like flu or cold. So they process. We just cook a little bit, but how you're mentioning the form of capsule.
The way that they do it traditionally, from what I know, is that they boil like hot water with parsley leaves, and then they drink it.
Okay. So it's like just soak in the hot water for Yeah.
And I try to eat it just by itself, the parsley leaves, as part of like with eggs or something else.
Yes, it's very good. Yeah. All the herbs, it's helping improving digestion and some circulation, anti-inflammatory.
Yeah,
So,
and
but
that's
it's-
probably the secret to longevity, right?
exactly.
Is having the
Tannins, yeah.
variety of all the different,
Yes.
antioxidants and plants to help, your body stay healthy and fight off infection.
Yes, inflammation.
Inflammation, yeah.